Hi, this is Shelley from Modern Nurse, and I want to tell you ways that you should be approaching nursing school or med school, if there happens to be any med school students watching this. And these things will help you get through your schooling. Nursing school, med school, they're tough. They're tough to get into, they're tough to maintain that GPA, that standard for getting through. And there is ways that you can approach it that will make it a lot easier and will help you become successful. Number one, having an attitude of excellence. Pursue your schooling with excellence. Don't slide through, don't go for the C, do other things so that you don't have enough time to study. You need to study so that you can get excellent grades. A lot of you are going to be going on to grad school or going on beyond for a fellowship or something like that. And if you don't have the good grades, you're going to get passed over on some of those opportunities. So really pursue your schooling with excellence. Number two, have organization in your life. Now, some of you might be scatterbrained. You might be very disorganized. You might be fly by the seat of your pants type people. Well, if you are not organized, you are going to have a very difficult time making it through your program. You are going to have to learn to be organized. It is a skill to be organized. Even though some people by nature are more organized than others, anybody can learn skills. The first thing you need to do is get yourself a planner. And you go through those syllabus and you get all of those dates written down. You put it in your Google Calendar or your Outlook calendar, whatever you're going to use to help you stay organized, where you can have reminders and notifications and things like that. It's going to be crucial so that you don't miss deadlines. And you might be in a program where you have a professor who doesn't have any grace if you miss a deadline. Pay attention to detail as well. Read those rubrics, the grading criteria that professors have set up for assignments. Detail matters in nursing school and med school. Number three, be a humble learner. You might not agree with a test question. You might not agree with a grade that you got on a project. You approach your professor with an argument and demanding they look at things a different way or give you a different grade. You are not going to do yourself any favor. And you're not going to be learning that humility that you need to have when you become a nurse or you become a doctor. Being humble is very much valued in those professions, and not to be arrogant and demanding. So start with it as a student. Be a humble learner. Number four, be a passionate learner. You approach every single class as it's your most favorite class, and that you can't wait to learn everything there is to learn, and that you read everything you can get your hands on reading. If you have to take a pediatric class and you know you do not want to do pediatrics, and you don't like kids, approach it as if you do want to become best pediatric nurse or pediatrician possible. Become passionate about your learning. Number five, adapt as a student in your program. These programs are very difficult to get through. You need to adapt to life as a nursing student. You have to put your own life on hold to get through these programs. You may have to change your lifestyle, change your routines, change your priorities for a while so that you can adapt. Number six, sacrifice. Comes right after adapt. There will be sacrifice. You cannot make it through these programs and maintain the same life you had before. You will have to sacrifice time with family members or loved ones or love interests. You may have to sacrifice family events. I have seen students think they have a right to continue to do that. And the truth is, if you want to succeed, you have to sacrifice a lot of those social obligations and social invites so that you can put the time in to your studies and get the good grade. Don't sacrifice your sleep, nutritious eating, and exercise. So don't sacrifice those self-care things. Number 7, be committed and stay motivated. Don't give yourself an out. If you give yourself an out, most likely you're gonna take it. Be committed to finishing and seeing it through. There's nothing worse than having to pay for a nursing program or pre-med program where you only made it 3/4 of the way through and you end up with a bunch of credits that aren't doing anything for you and your career plans. So please, please stay committed and finish what you've started. Number 8 is be connected. Try to make 1 or 2 good friends in your cohort where you're going through this at the same time. They may be the only friendship time you're gonna have because you're gonna be so busy, but you will have a much more enjoyable time in your studies if you are connected with people. Form study groups, and then they can help you get through and get better grades when you are in study groups. And lastly, be realistic as you go through this program. You're not gonna come out making 100 grand first time around. You might not even get your dream job first time around. I didn't. My dream job didn't happen till my second job. Be realistic about yourself. Be realistic about how much time you're going to be able to put into this. And don't make that commitment to even get in a program unless you can put the time in to get the good grades and to be successful with what you want to do, which is become a nurse, become a doctor. You can do it, but you have to have the right approach to doing it and succeeding. Good luck. This is Modern Nurse.